Hi, Annetta Benjamin. How are you doing?
I'm doing well. How are you?
I am great. I am so excited to have you back on. It's been a year.
Yes, yes, it went by fast.
It did. And thank you, everyone who is joining us and who's watching. And for those of you who don't know, when we started a year ago, just getting into the pandemic, Annetta, you were one of the first, if not the first people that I started to interview.
Yes.
And so for those of you watching who are catching up, Annetta, tell us who you are, what your background is, and all of that good stuff.
Sure. My name is Annetta Benjamin, and I'm a licensed professional counselor here in the Lake Ridge, Woodbridge area. And I've actually been in practice now for 10 years.
Mhm.
And I work with children, adults, ranging from anxiety to depression, bipolar,
Mhm.
family issues, divorce. So we do a lot of mental health concerns and just really helping people improve their lives and encouraging them to achieve the things that they want. But this past year has been very interesting with, the pandemic and COVID.
Yes, it has. And I am grateful to you for agreeing to come back and talk to me and have this discussion because I really feel that the topic of mental health needs to be amplified and people
Yes.
need to feel, comfortable, just feel okay asking for help
Hmm.
and knowing where to go to get help.
Yes.
So let's get right into it. So Annetta, in our last interview, we talked about ways to handle stress. And at the time, the pandemic was fresh. And the expectation was, oh, this will be over in a month or by
Yes.
summertime. But here we are 11 months later. So in your words, can you tell us about COVID fatigue and articulate what it means and how it manifests itself in teens and adults?
Yes, well, I'm glad that you're bringing this topic up because it is very huge and, it's been something I think most people have been struggling with, but not necessarily talking about. So
Yes.
this is a great topic. But COVID fatigue is what it says, it's really just being tired and drained, overwhelmed with the whole circumstance. And you're right. I think in the beginning of, the pandemic, everyone was thinking, okay, we'll do a month or two
Mhm.
and it'll be over, especially with schools. I think
Right.
when the school shut down, it was really surprising, like, okay. And, the kids were celebrating, the parents were kind of confused, but we just went with it.
Yeah.
And I don't think when September hit, where, kids returned to school, no one expected it to all be online and
Mhm.
virtual.
Yep.
But I think, COVID fatigue is more about being drained and overwhelmed with the circumstances and just feeling like life is not getting better. It's
Yeah.
almost like a heaviness that just sits with you. You want more, but then you're kind of restricted because of the situation and the circumstances.
Right.
But I think it definitely affected a lot of teens, especially from what I see from my angle being in private practice and as a counselor. I've seen a significant increase with adolescents and teens who have been struggling,
Mhm.
academically, emotionally, socially with the
Yeah.
changes of COVID.
Yeah, and I've witnessed some of those things just in talking to some of my friends who are parents of, pre-COVID, their teens and kids were, straight A students or good
Yes.
students, participated in a lot of athletics, and now they're at the point where they are struggling in their school subjects.
Yes.
And a couple of my friends have kids, and they're like, well, I can't even get my kid to get out of bed.
Yes.
So,
Yes.
and so it breaks my heart to hear of people going through that. But what are some of the signs, especially, if you're one of these parents who you're in your own groove and
Hmm.
you're used to your kid being quote unquote okay, what are
Yes.
some of the signs that we need to look out for when it comes to our kids?
Definitely. And I think some of it we did touch on last time where, just being extremely drained or, maybe there's signs of depression where they're isolating themselves, they're no longer connecting with friends, even if it's virtually, but at least they have that communication. But if you see that they're in their room all day long, maybe sleeping majority of the day, you know, not eating or gaining weight, all of those are signs that something is going on and that child needs a little bit more help. And mostly, their self-talk. If they're talking negatively or talking about they don't want to be here, that, life sucks and, all of these negative terms, I would be paying attention to that so you can ask a little bit more questions and find out what's going on, because it's easy to kind of dismiss it, but
Yeah.
when it becomes persistent, you really want to pay attention to it so things don't become worse.
Right, right. And what about on the adult side? Because I know for me personally, I have lost 4 family members
Wow.
since December. And
Wow.
it's taken its toll on me. It's taken its toll on my family. What about us adults who sometimes, like you said, that heaviness?
Yes.
What are some of the things that we should be looking out for when it comes to our adult friends? Because I have my tribe,
Hmm.
and we check in with each other, and I'm really thankful, really,
Good.
really thankful for all of the people who call and checked in on me.
Good.
Um,
Good.
but what should we look out for? Like I said, when we're going through our daily routine,
Hmm. Hmm.
and we don't hear from a person that we normally would, what should we be looking out for when it comes to adults?
Yeah, and I think that is a huge topic because a lot of times we're so paying attention to our children that we don't notice what's going on with ourselves.
Hmm.
But, if you know a friend that has lost their job, who, they're strained with income or, dealing with, other financial or family stressors, definitely check in on them because it's becoming overwhelming. And like you said, a lot of people have lost loved ones this year.
Yes.
And I think sometimes we just check in and just say, hey, but you want to give a little bit more time and effort into asking how they're doing.
Hmm.
And if you see that they're once again isolating themselves or, not reaching out as much as they used to, then it may be time to seek professional help for that adult where
Yeah.
they can reach out to a counselor and, have more support and have someone listen to them.
Yeah, because I think in terms of how we've come over the past year, we've come from, oh, I don't know anybody who's gotten COVID, to, okay, I know someone who's tested positive, to, okay, I know someone who's tested positive and gone to the hospital, to, I know someone who's got it and passed away. And I think we're at a point where every single person knows someone who has been affected by COVID in
Yes.
some way,
And
shape.
it's coming closer and closer because it's hitting people's families or right in their homes.
Right.
And I can tell you from my standpoint as a therapist, several of my clients had it, and a lot of them had it affected in their entire home where it maybe hit 3 generations that were in the home, the
Yeah.
mother, the grandparents, and
Hmm.
the children as well. So most people did, have some kind of closeness to a person who tested positive or passed away from COVID.
Right, right. Now, tell us what you've seen at your counseling center over the past year, through the pandemic. What's it been
Yes.
like, in terms of what you're seeing people, the children and the adults who are coming through your door?
Yes, I think that's the biggest thing. We've had more people come through the door. Well, not actually through the door because everything is virtual
Okay.
and by phone,
Hmm.
but we've had an increase in people reaching out for mental health help, where they are seeing the signs that we talked about. Either their child is, regressing in school or no longer as active. And I think that's the hard part because a lot of us as parents kept our kids maybe in activities or
Yeah.
sports, things that could just keep them busy. And then all of that was taken away.
Hmm.
And it drains a child, drains the parent too. But we've had a significant increase in mostly adolescent children, where middle school to high school, where they are experiencing a lot of depression and anxiety, worry about, am I going to pass? Because it's a difference with learning in school and then online,
Right,
because
right.
online you really have to be self-motivated.
Hmm.
In school you can kind of have your teacher encourage you, you have examples, you have other students, but at home you have to be motivated, and a lot of kids had a hard time doing it on their own.
Hmm. Definitely. What advice can you give to parents who, we're coming into spring and we're going to get some warmer weather. What
Yes.
role does exercise play in mental health?
It is huge. I mean, I think it really gets you going and helps you to become motivated. I know for myself, that was my saving grace throughout the pandemic. I think the first 3 or 4 months they shut down the gyms and I was like devastated. I'm like, oh no, that's my therapy.
Yeah, yeah, practically everybody I talk to, myself included, we've added on what I call that pandemic pouch.
Yes, definitely.
That
And
10
I
to
went
20
through that too.
pounds of extra weight that was not there before.
Yes, yes. I kept saying it's COVID-19 because everyone's gaining at least 19 pounds. It's just
Yes,
crazy.
yes, indeed.
Yes, but I think you do want to get out and just have some fun. I think a lot of times we are so stuck in our routines, and that's what happened with, I think, the pandemic. We all recognized that we were set in our ways, and then to have to adjust was really, difficult. But now I think people have to get more creative. I was talking to a client last week, and she just felt so restricted. It was another teenager. She's 17, getting ready to graduate this year, and just feels like, I can't do anything.
Right.
But we talked about, like, maybe you used to have 10 options to choose from to have fun. And now, because of the pandemic, you only have three.
Hmm.
But look at those three and use them. I
Hmm.
think we do have options. They're more limited, but we still have options. And so you can get creative in the home. You can go outside. You can create new routines with your family. So you have to really think outside the box to get motivated. And then I think once you're in it, you're no longer in that mindset of the COVID, feeling drained, feeling overwhelmed. You're now focused on that activity and you're actually enjoying it. But I
Yeah.
think people have to decide that, okay, I'm going to do something different. And when you have that new mindset, like, your world opens up.
Yeah, and I can speak from experience when it comes to getting outside because I live near Occoquan Regional Park, and
Yes.
it's over the past spring and summer, it was just crowded.
Yes.
Even lines of people waiting to kayak. We love to kayak and paddleboard.
Good.
So it was good to see so many people and so many families just
Hmm.
outside together. And even
Yes.
when I walk my dogs around our neighborhood, I see, I've gotten to meet neighbors that I've never
Good.
met, and we've been living where we are now for 6 years. So it
Hmm.
is good to see people get outside more.
It definitely is. And for the first time, like, the sidewalks, it was traffic on the sidewalks.
I know. And even at the stores, the bicycles were gone and
Yes.
the Peloton bikes, people were telling, I don't have a Peloton bike, just let it be known. But I know I heard that they were on back order. A lot of home exercise equipment was on back order because people
Yes,
were trying to
definitely.
set up home gyms.
Hmm.
Yep. So, and now one of the things, particularly in the past year, on top of the political tension, we witnessed a lot of racial tension throughout the country. Now, can you speak to us parents about how to handle the stress and trauma of witnessing the racial tension on top of the pandemic? Because
Yes.
we've definitely had to have a lot of conversations at home
Hmm.
about what's been going on throughout the country. So what recommendations do you have for parents when it comes to talking about racial issues?
Yes, I think really trying to figure out where your child stands with it and how they feel. A lot of times it's just listening to them to be able to allow them to have a voice, because I think a lot of times children, store information or they feel a certain way, but don't necessarily talk about it. So if you
Mm-hmm.
can give them a platform to speak, it'll kind of release that heaviness and allow them to feel like, okay, someone is listening, someone understands me.
Mm-hmm.
But and it's hard because it was very intense, and I saw
Yeah.
it from both angles. Being a therapist, I had some people who were for someone, some
Mm-hmm.
people who were against them.
Right.
But I think the idea was to focus on what you can control and don't focus on the things that overwhelm you or stress you out that you are not in your control anyway. You know,
That's
you
a good
couldn't
point.
change the president, you can't change his personality, and you can only do your part, you know, by voting. And
Mhm,
then I think just doing your part and then letting it go.
mhm.
But if you were to store it, hold on to it, you know, especially with social media, there was so much tension. A lot of people lost friends, you know,
Yeah.
on Facebook and things like that, where it just got really ugly. But
Mhm,
if you could focus on the good, then I think that helped relieve a lot of the stress. And that's what I encourage all my clients, you know, turn off the TV, get
mhm.
off your cell phone, you know,
Yeah.
focus on the people that you do love. And then it shifted their entire mindset.
Yeah.
But it was intense. And even for me as a therapist, there were some sessions I just had to step back and say, whoo, I need a break. Or,
Wow.
you know, I have to collect myself before I go into another session because it was draining.
Yeah, yeah. And I think what you said about kids, listening to them, I think that that's really key because, we listen to our kids and a lot of times you may tend to think that they think a certain way when in actuality, when you ask them a question and let them speak, they have a totally different perspective. And
Yes.
so it's good, family dinner conversations, it's good to just hear what they have to say because
Yes.
I can speak to from personal experience that a lot of times our kids they articulate their points very well.
Mm-hmm.
I'm really
Mm-hmm.
proud of my kids and
Good.
their perspectives, but we've had a lot of deep discussions
Mm-hmm.
and and some of the things they say I'm like, what, I didn't know you knew that.
Yes. It's surprising when you listen. Mm-hmm.
Yeah, definitely.
Mm-hmm.
So, well, Annetta, thank you so much. This has been great. And I'm always glad that you make yourself available for these Zoom interviews
Thank
because,
you.
particularly like I said earlier, when it comes to mental health, I want to put it out there that it's okay to ask for help. So
Definitely.
if someone wants to reach out to you, Annetta, what is the best way for them to contact you?
Yes, we are available by phone 703-494-1434, but the best way is online, especially because a lot of our therapists are out of the office and working from home. If you go directly to www.benjamincounseling.com, you can click the contact section and send us an email or a note about what's going on, and we'll be glad to help you.
Awesome. Thank you so much. And it was a pleasure having you back again.
Thank you. Take care.
Okay, you too.